Welcome to Jewish Midlife. Hi, I'm Devar Krasnians, and today we're diving into pelvic floor health during midlife with Susan Winograd from Pelvicore Rehab in Boca Raton, Florida. Our pelvic floor is crucial, performing 5 key functions, so keeping it strong is essential. Did you know that breathing is key to keeping our pelvic floor and core strong, and that there are many other exercises beside Kegels for our pelvic floor? Susan talks about the 5 pillars of health for keeping our pelvic floor strong and about tuning into our body's check engine lights, signals that something needs attention. We also discuss how aging doesn't mean that we must accept our bodies slowing down. Even if we haven't taken care of our pelvic floor before, there's so much we can do to get it to optimal health. As Susan says, it's too late to procrastinate, and it's never too late to start. So join us as we explore strategies and insights to maintain a robust pelvic floor and enhance our quality of life. Here we go. So Susan, I'm so excited that we're talking because when I listened to your class that you gave a few weeks ago, there was so much to learn about pelvic floor for all of life, but I'm specifically listening for the midlife. And I'm so grateful that you offer to bring some of that wisdom to our audience. So thank you.
Thank you so much for having me.
And before we get started, let's just talk about what do you do and where you're located. And then we'll talk about what is pelvic floor.
Sounds great. My name is Susan Winograd. I am the founder and CEO of Pelvicore Rehab. We are a pelvic health and wellness center in Boca Raton, Florida, and we really are driven. Our mission, our vision, our passion is a whole body approach to pelvic health and wellness. And it really absolutely has to be a whole body approach. And we are also, part of our mission is education, which is why I love having these conversations. So thank you so much for having me.
Okay, so Susan, let's go straight into it.
Yes.
What is the pelvic floor?
So that is like the $20 million question. And this is such an important conversation because the pelvic floor is really part of what holds us together. It is a group of muscles that lay at the base of our pelvis and goes from the pubic bone all the way back to the tailbone and from one side of the hip to the other. So if I were looking at your body from the head down, looking down into your pelvis, the pelvic floor muscles would look like a hammock. They would look like a bowl, hence a lot of people call it the pelvic bowl, or a hammock-shaped group of muscles that literally line the bottom of your pelvis. The interesting thing about the pelvic floor is that it's way more intricate than people think. There are 3 layers of pelvic floor muscles, and each layer has at least 3 muscles. So when we're thinking about pelvic floor function and efficiency, we have to make sure we're looking at all 3 layers, all 3 muscles in each layer, and left and right. So it's more extensive than people think, but the good news is that the pelvic floor muscles is like any other skeletal muscle in the body, like the biceps or the hamstrings. It responds beautifully to physical therapy and strengthening and relaxation, just like any other muscle in the body. We just have to know how to listen to the cues of it, to make it work optimally and efficiently.
Right. Okay. So we're talking about that part of the body, like the middle part of the body, left to right,
Yes.
front to back. Okay. So what does those muscles do for us? Let's talk about what that is.
Yes. So the functions of the pelvic floor muscles are really right. A lot of people think when they think of pelvic floor, they think of Kegels. And I know that we're going to get a little more into like the more general, really important part of the pelvic floor. But when I think of the functions of the pelvic floor itself, I think of 5 S's. Right? That's what we talked about in the workshop that I gave in North Miami Beach. And it's a really easy way to remember. So there's a sexual function for sexual appreciation, because the first layer of pelvic floor muscles is the external genitalia, what you see on the outside. So there's a big there is a big sexual appreciation component. There's a big support component because our pelvic organs live right on top of that third layer of pelvic floor muscles. There is a stability component. So the stability component is that the pelvic floor is actually part of the pelvic floor, a part of the deep core system. And I know that we're going to talk about that in a minute. It's what keeps us upright. There is also a lymphatic component to it. So we call it a sump pump, meaning that it helps to, every time a muscle pumps, it helps to pump fluid back into the circulation so that we don't have swelling, so we don't have congestion in that area. So there is a lymphatic component. So there is a very broad range of really important functions that the pelvic floor provides for us.
Right. And so that's why we have to really take care of it for each one of those separately. But what I'm understanding then is we take care of it for one, we are also kind of taking care of it for the others. It's like a all in all.
Yes, yes, it's whole body. So right, so we if we look at the functions of the pelvic floor and we help people keep it healthy and optimal and efficient, then essentially we are really including all of those functions and making sure that all those functions are working optimally.
Okay, so let's talk about how we can actually take care. So they're muscles. So like
Yes,
all muscles, they can be strengthened or weakened if you can
yes,
take care of them.
yes.
So we can talk about what to do.
Hmm.
And I could imagine that there's some things that we should not be doing also. So
Yes, yes.
let's start from
That's
somewhere.
great. That's, well, one of the things that I would say we should not do is self-diagnose. And that is because the entire functioning of the pelvic floor is based on length tension relationship. So if we think of the pelvic floor like a hammock, right? Um, the hammock has to be tight enough to or taut enough to support the pelvic organs, but not too tight to compress them. And it has to be have enough given it to expand and contract, but not have too much laxity so that we can't then contract. So that length tension relationship is very sensitive and important. We don't want to self-diagnose because the symptoms of pelvic floor tension, a pelvic floor that's too tight, or pelvic floor weakness can be very, very similar. So, for example, I very often have women that come to me that say, I started having pain, or I started leaking, or I started feeling certain sensations, and I started doing Kegels, and I don't understand why it's making me worse. And then when we do a thorough assessment, what we learn is very, very often those people have pelvic floor muscle tension patterns. And what we really needed to do was release the muscles and not continue to contract them. So I think if you're having any sort of concern that something's going on with your pelvic floor or you want to optimize it, go to a professional that's going to do a proper assessment and tell you what you need. That's one of the things that I think we should not do is self-diagnose. One of the things that I think we should do is keep that part of the body healthy throughout the lifespan. So I think that we talked about this, and I see a lot of women that come to me in midlife. And, what I tell people, it's never too late, right? It's always too late to procrastinate. It's never too late to start. So whether you've been, you're in midlife and you've never done anything for your pelvic floor, that's okay. It's never too late. But if you are younger, to be proactive about your pelvic floor health, because very often a lot of those symptoms can come out later in life if you weren't proactive. The other thing is that I think that you should do is get a very individualized program for your pelvic floor, because a lot of people do need Kegels, they do need pelvic floor exercises, but we want to give them a fit prescription, an individualized prescription for function, for intensity, for interval, for timing. So it's not just I'm weak, I need to do Kegels. It's how long do you need to do Kegels for? What kind of Kegels do you need to do? How many repetitions? How many times a day? Do you need to focus on one side of the body more than the other? So I think it's very, very important to get an individualized exercise prescription. And I would say that goes for any part of the body. did that answer your question?
That's a good overview. So I want to go to how do you know? I think you called it check engine lights, and I love that
Yeah.
phrase. And so let's
Yeah.
talk about what some of those are. Like, how do you know you need to see somebody?
Yeah, so that's a great question. So I call them check engine lights, right? Our body has a brilliant way of talking to us. So with the pelvic floor, I call them the 4 Ps: peeing, pain, poop, and pressure. That's basically the very broad check engine lights that if you feel you're peeing, urinary urgency, frequency, incomplete evacuation, pain, dribbling, leaking, urgency, like I said, waking up in the middle of the night several times to go to the bathroom, that's a check engine light. That's your body telling you, I really should see a pelvic floor specialist. The other one is pooping, which is constipation, fecal urgency, fecal incontinence, incomplete evacuation, anything that's out of the ordinary routine of your pooping. That's a check engine light for your pelvic floor. Then we have pressure. So pressure, a feeling of dragging, a feeling of falling out, a feeling like there's a tampon stuck and but there's nothing in there. That is a very indicative that you should go to a pelvic floor therapist to rule out what's called a pelvic organ prolapse. And again, we're not doctors. We always work in conjunction with the healthcare community. And then there's pain. So we could have pelvic floor pain. We could have pain with intercourse. A lot of times, pelvic floor pain manifests as hip pain or groin pain or low back pain or even rib pain or bra line pain, because we know that the root cause of pain could actually be at a distant site from where you're feeling it. So about 80% of people with pelvic floor dysfunction also have some kind of low back pain. So it's not enough to think if, I have pelvic pain, that's a pelvic floor issue. It could be a much broader scope of painful symptoms.
So talking about some of these things like leakage, they say is like as you get older, that's what happens.
Right.
And maybe, but it's also something to see somebody about, not just
Right.
accept it.
So I think that is really important to talk about and blast throughout the world that what's common is not only normal, and leaking is not normal at any age. End of story. There are different kinds of leaking. So one kind of leaking is stress urinary incontinence, when you're leaking, when you're laughing, coughing, sneezing, jumping. Urge urinary incontinence is when you have a really strong urge that you can't overcome in time to go to the bathroom. Any kind of leaking is not normal. I know that I shared a couple of stories about women in their 80s or, 90s even, who came to me because they started leaking and they didn't want to, and it should be resolvable at any age. Again, leaking, there's a bunch of ads out there that want to normalize wearing diapers and pads, and that's because they make bucket loads of money on them. But I will tell you that I am passionately confident that taking care of your pelvic floor will be way more cost effective in the long run than having to spend money on protective pads for the rest of your life, because that's really, really expensive. One of the protective garments had a tagline in their marketing that said, leaking is just part of being a woman. And we really, yes, that's their tagline. Leaking is just
Oh.
part of being a woman. They want to normalize it. They want us to think that we just have to accept it. And that is absolutely not true. We need to empower ourselves and each other to say that that's really not the case. That's not normal. Just because it's common does not mean it's normal.
So now let's talk about men in general, pelvic
Yeah.
floor health in men. Their parts of the body are different.
Yeah.
So
So actually, men have almost identical anatomy of their pelvic floor with just a couple of exceptions. So obviously, their external genitalia is different and their pelvic organs are different, right? But they also have 3 layers of pelvic floor muscles. The origin and insertion of the anatomy is the same. They also have 3 muscles in every layer. So we do help men as well in our practice, and men can have the same pelvic floor issues as women. They can have the same symptoms. They have the same the four check engine lights, peeing, pooping, pain, and pressure could be a sign for them as well. So it's a misunderstanding that Kegels and pelvic floor therapy and that part of the body is really a woman's issue. It really is a men's health issue as well.
So just going to men and then come back to women, but
Yeah.
some of us midlife have men in our life too.
Mhm.
So if a man has urgency, is
Mhm.
that something that can be dealt with exercise and pelvic floor, or is that something that has to be done with medicine?
No, it absolutely should be done with pelvic floor. That should be the first line of treatment. So, and obviously, I have a pelvic floor bias, but I think the first line of conservative treatment for any bowel, bladder, or sexual dysfunction should be pelvic floor physical therapy. Why are we throwing medication on things? We need to make sure our body's working optimally. When I think of medications for those type of things, I think of a fire burning and you're trying to put a damp cloth over the fire, right? You may be taking care of the issue on the surface, but the problem's still raging underneath. So we always have to get to the root cause of what's going on and stop putting a band-aid on things, which is medications. So if a man has urinary urgency, frequency, leaking, they absolutely should go to pelvic floor therapy. I think pelvic floor therapy is more effective than medication. It's more functional, it's more life lasting, and way less side effects, right? Why would anybody want to be dependent on a chemical substance for that?
Right, and as we said earlier, that if we take care of these exercises, whatever it is, it also helps in other areas as well, in other areas of
Ab-
your life. So you're getting more for
Absolutely.
your bang, more for maybe it's a little bit more effort
Right.
every morning or every
Well,
day than popping a pill. I mean, it
right.
is. It's more time consuming.
I'm going to say that, but I'm going to flip the story a little bit and say maybe it's a little more effortful in the moment, but in the long term, you're saving yourself a lot of aggravation. So, in my eyes, everything is about big picture. Do you want instant gratification now? Or do you want to empower yourself to be healthy and optimal for the rest of your life? Because if you want instant gratification now, I really do believe there's going to be a health debt to pay later, right? We always
That
have
makes
to go to the
sense.
root cause and treat the whole body. But
So,
that's just in my eyes. And it is, I guess, in theory, easy to take a pill and people think you get instant gratifications, but then you go down that rabbit hole of side effects and you need another medication for the side effects that one medication caused. I don't think we should be thinking about health in terms of pills. I think we should be thinking about our health in terms of optimizing our body so we don't have to take pills.
so looking at your lifestyle
Hmm.
and the food that you're eating, then maybe moving into supplements
Yeah, so
and
we
before
talked about
all before we go to medication.
Yes. So in our practice, obviously we do physical therapy, but we have holistic wellness programs and we have 5 pillars of health that we believe everybody has to consider with any health concern. And we need to individualize that for every person. But our 5 pillars of health are detoxification, because we have to make sure our liver is functioning optimally. Nutrition is foundational for pelvic health. Um, then we have hormones. We need to have hormone balance, movement. So movement could mean meditation. Movement could mean cardiovascular exercise. Movement could be, weightlifting for bone density. That has to be individualized too. And mentorship. The mentorship comes in where I think we need to stop going on Google. We need to stop self-diagnosing and really get the proper help we need once, so we have a system that we can continue to implement for the rest of our life. Is
I
that what
also,
you mean? Did I answer
yeah,
your question?
right. But I also think that in that mentorship, I think that while you need to have the right guidance, I think that I see it also as accountability. Like, let's do this. Let's
Yes.
really do this. And if you're not going to do it on your own and you need to do it with a buddy or
Yeah.
somebody, just let's do this.
Yes, and I couldn't agree more. And one of the things that I was determined in my own life, in my profession, is that I was always going to have a mentor, because I truly believe that if anybody who's successful in any area of life have mentors, and that goes for your pelvic health. There's nothing wrong with that, right? We have personal trainers for exercising. People are social beings. So when we can create a community and accountability and mentorship, it just creates an environment for success. So I absolutely agree.
Right. So now let's talk about the idea of breathing as it impacts the pelvic floor, or really
Yeah.
everything, but let's just talk about it more for
Yeah,
now.
yeah. So this is my favorite topic. Everybody knows that I'm obsessed with breathing. But before we talk about that, I think we need to understand why we're even talking about breathing, right? How does that fit into the pelvic floor? And I think what everybody needs to understand is that the pelvic floor is part of a bigger system called the deep core system, which is right in the center of our body. It is like a container in our body. It's like a hydraulic pump that works. And there are four muscles that make up that system. There's the pelvic floor on the bottom. So that's the floor, hence the name. And then the top, the roof of the deep core system is the diaphragm, the muscle for breathing. In the front, we have the deepest abdominals, and in the back, we have the deepest extensors. And all those four muscles work together in a coordinated way to keep us upright through life. The fascinating thing about this system, right? A lot of people, when they think about the core, they think about the six-pack muscles or the obliques or doing crunches. That's really not what keeps us upright. Those muscles are very superficial. They are part of our superficial core, but our six-pack muscles is only going to engage when we bend forward because it's a trunk flexor. We need something that's going to keep us upright when we try to catch a ball, right? That is what our deep core system does. And our deep core system is fascinating in that it is the only system in the body that's anticipatory. It's reflexive. It will engage 30 milliseconds before we move, before we jump, before we cough, before we take a step, in order to protect us, to keep us upright. So I think we need to have a basic understanding of what the deep core system is and understand that the pelvic floor is part of that. Now, the fascinating thing about the deep core system is that that whole system is led by the breath. So the second we take a breath of air into our lungs, we inhale, we fill our lungs with air. That growing volume of air in our lungs pushes and flattens the diaphragm down. That makes our abdominal contents go down, and our pelvic floor lengthens, broadens, and relaxes. Then we exhale, the air is let out of our lungs, and everything shortens, recoils, and engages. So that entire deep core system, the system that keeps us upright in life and supports us, is led by the breath. So the breath really has the ability to impact every system in our body, from our nervous system to our digestive system to our pelvic organ system to our pelvic floor. So when we're thinking about pelvic floor health, we need to think about the breath, right? Because when we inhale, the pelvic floor lengthens and relaxes. When we exhale, it shortens and recoils. So the best way to think about the health of the pelvic floor is to use the cycles of breath. For example, if you've ever been at the gym and worked with a personal trainer or taken a class or worked with a pelvic floor therapist, they will tell you if you're doing something that's challenging, exhale with it, exhale with exertion. And that's because that's the natural cycle of the deep core system when it contracts, when it engages, right? If we are wanting to relax the pelvic floor, then we'll focus more on the inhalation where it broadens, relaxes, and lengthens. So the breath is used to impact every system of the body, and we use it as a foundational component of pelvic health. Does that make sense?
Yeah, I think so. So let me understand. So the core muscles, the pelvic core muscles, need us to be breathing and intentionally breathing, not just the shallow breathing, so that they actually.
Yeah, yes. Well, yes and no. We breathe intentionally to make it automatic. So we can't go around thinking about our breath all the time, but sometimes we get into compensatory patterns where our breath is not working for us as well as it should. Then we become intentional about it, but really our goal is to breathe to keep us alive, and that is the number one role. That is the number one concern of our body, of our nervous system. So we can't go around thinking of how we're breathing all the time. We want to train it as an optimal and automatic function of the body.
So there is a better way to breathe then to make it to
There are
have our
different, I
consistent.
love that question. That's my favorite question. There are different breaths for different purposes. So it depends what we want to do. When we're thinking of core health, we're thinking of a diaphragmatic breath. We're thinking of a core breath where we want those core components to work with the breath in a coordinated way to support us. But there might be times when we're doing yoga or we're doing different mindfulness exercises where we might change the breath for different purposes. And that's okay. We have to understand why we're doing something. That's why education is so important.
So just the regular being breathing,
Yes.
but I'm on the computer and I'm not doing intentional breathing. Is there a better way that I could have trained myself to breathe just in general, that my breathing could be better than the
It's
shallow breathing?
possible. There's always a more optimal way. And it really has to be individualized. Breathing optimally looks different for every person. Also, the efficiency of your breathing is also very dependent on your alignment, right? Your diaphragm and your pelvic floor work best when they are in alignment with each other. So if we have a very slouchy posture, that might lead to compensatory patterns for breathing because our core components are not aligned. Or if we have like a military posture where our shoulders are back and we're constantly, bringing our shoulders back and head up, then our rib cage is behind our pelvis. So there is optimal alignment. I would say there is probably optimal breathing, but I never want someone to become hyper vigilant about how they're breathing. I want them to be able to tune into it, be aware of it, feel what they're supposed to be feeling, and then go on with life and not think about it.
Right. So what I'm understanding then is they come in to a pelvic floor specialist. They can help you see how your body is aligned and
Mhm.
the optimal breathing for that. Maybe we're doing it right for our alignment, or maybe there's
Correct.
a tweak that we can be doing.
Correct. I will tell
But
you
know
that,
that. But
yes,
get to, yeah.
yes. Most people don't. Most people are actually floored when they come in and we look at their alignment and they're like, "Oh my gosh, I feel like breathing feels easier now. Like I'm feeling so much more centrality of breath." And here's the thing, when we are aligned better, we breathe better, and then our core works better. And people that exercise, they feel lighter. They feel like they could lift more. They feel like they can, run farther when they're working more efficiently. But it's really like parts of a big puzzle. And yeah, so people come in and we help them tweak that, but that has to be individualized. There's no such thing as shoulders back, head up for everybody, right? Everybody's different, but we were talking about developing compensatory patterns. And I would say for everybody, but especially women who have gone through pregnancies and their bodies changed so much in such a short period of time, that's almost always when we see shifts in alignment and breath patterns.
So for someone in midlife, from what we hear is like we just get weaker or unless we're taking care of ourselves. So like if you weren't exercising all along, you'll start really feeling it. So for those who were exercising all along, great. So what I'm hearing then is that we should really check it out, like get ourselves back on a track, starting with maybe other specialists, another medical specialist, but let's just talk about from pelvic floor, is like
Yeah.
get ourselves into a good track of our alignment, our breathing, and some exercises that will strengthen that, and so that we could pick things up and stop saying that we can't. And it's not only from our muscles in our arms, it's from our core also.
Absolutely. I think that is the biggest favor that people can do for themselves, because just that education can take you such a long way to help you feel vibrant and energetic and strong through that season of life.
Because it's not just like, okay, so this is it, I'm getting older, and so I won't be able to
Yeah,
whatever.
I don't know where that mindset came from, but I certainly don't feel that way. I'm gonna go down kicking and screaming. I feel like we are meant to feel vibrant. Midlife is when we've done so much in life and we really want to start engaging in our hobbies and even pursuing new hobbies and being active and traveling. And we have to feel good and we have to have good endurance and good strength in order to do that.
You don't want to say, oh, I'm just too old to travel. Like, we
No.
should travel
No.
all the way and
Yeah,
you continue hiking.
my patient care coordinator, Zara. Hi, Zara. She's what keeps everything going here. Her husband is a tennis pro. And last week she sent me a video of his 94-year-old client playing singles with him.
Can.
So I feel like it's just about how you take care of yourselves. I have people that come in all the time in their 80s that are pickleball players, and they're just like, my goal is to continue playing pickleball till I'm 100 years old. And I think that's fantastic and phenomenal.
And we don't have to slow down just because maybe in the past people did slow down. I don't know, like, why.
I think we're more sedentary now. Like if you look at the Blue Zone documentaries, which are fascinating, the scientists looked at centenarians, which were people that lived over 100. They didn't slow down. That's why they live so long, because they keep moving. So
But they
motion
were
is
moving
motion
on real life.
on functional, right? They didn't do contrived exercises, right? They planted and plowed and pursued
Walk
their
to their
hobbies,
neighbors.
walk to their neighbors. When they wanted a cup of coffee, they actually made a cup of coffee and not go to Starbucks. And then now people don't even go to Starbucks anymore. Now they go through the drive-through.
Or
So
they
I
order it and they don't have to, they have to walk to the door to open the door.
Yeah, exactly, exactly. So I feel like we've gotten so sedentary, and I would say that all of those things are not a luxury, that instant gratification. They're really doing us a disservice.
Right. So what are some things that can come up in midlife that are because we got to midlife, assuming that we were more or less taking care of ourselves, something
Yeah,
didn't show up?
so when we get to midlife, we are going through changes. We want to be realistic and honest with ourselves, and there are hormonal shifts that are going on in our body during that time. As we approach perimenopause, which is 6 to 8 years leading up to menopause, our hormones could be all over the place. And then those are the years leading up to menopause. Menopause is actually ascertained retroactively, which means 12 months that you didn't get your period. And then postmenopause is all the years after that. So all those years leading up to that point, we can really have hormonal fluctuations. We can have a decline in estrogen production, in testosterone production, and in DHEA production. And that can change our tissues. It can change our energy. It can change our drive and our motivation. So, just in terms of women and their pelvic floor, as our body stops to make as much estrogen, it can thin out our pelvic floor tissues, our tissues in general. And then women can start experiencing dryness. They can start experiencing even more lower urinary tract symptoms, because the bladder and the bladder neck and the urethra are very estrogen dependent. So we can start seeing all of those symptoms, in addition to some women experience pain with intercourse, hot flashes, brain fog, all of that. And that could directly be a result of actual hormonal shifts that are happening. So again, those are check engine lights. It doesn't mean that we have to accept that we're going to have stubborn belly fat, or that we're going to have brain fog, or that we're going to have lower urinary tract symptoms, we have to know what our options are and then make a very educated and thoughtful decision, right? So some women opt for bio or for hormone replacement therapy, and I can do a whole podcast just on hormone replacement therapy, but that's a really good option for some people. Some people don't want or cannot use hormone replacement therapy. And in those situations, we look at more holistic options like foods that are phytoestrogens that mimic the effects of estrogen, or creams that mimic the effects of estrogen. So I think that we have to acknowledge that our bodies are going through a shift. We are going through major hormonal shifts, but not lie down and accept it. Say, okay, this is what I'm feeling. My body's communicating with me. I need to gather all the information from a knowledgeable source, gather all the information, and then make a thoughtful decision about what I'm going to do moving forward. And that could include exercise. Again, it's holistic. It's hormone balance, it's exercise, it's nutrition, it's making sure that your body knows what to do with the hormones that you are making. But our body is changing, and we need to help it along the way as it changes to keep it optimized. Does that make sense?
Yes, and again, there are lots of questions. So
Yeah.
we'll talk about perimenopause, where it's shifting,
Mhm.
but after menopause, where it's a kind of stable, a
Mhm.
very, very low or none.
Yeah.
So is that everything you said, it applies just as well?
Yes, even more. So after we stop, essentially our ovaries make most of estrogen and our adrenals make a little bit of it. So when we're actually have gone through menopause, our ovaries essentially stop making estrogen. And what happens is that we then can develop genital urinary syndrome of menopause. It used to be called vaginal atrophy, but they didn't really like that name, so they renamed it GSM. Okay. But what's important about that is as we live in menopause, our tissues do continue to change. So we want to have an understanding of what those changes are and have an understanding of what our options are to optimize those tissues. And again, that could look like hormone replacement therapy, or it could look like natural options, and it could look like exercises, because when we do the proper exercises for our pelvic floor, it brings blood flow to the area and it brings oxygenation to the area. So exercising in the right way is a very, very important part of that.
Okay, so that's wonderful. So that HRT is definitely can be a part of that for pelvic floor and for everything else that it can do.
Absolutely. It has to be right. So here we meet people where they're at. Some people are all about, but, and I'm much more into bioidentical hormone replacement therapy than more of the synthetic kind. I think everybody should be looking at bioidentical hormones. But some people can. So we really have to meet the person where they're at. We're always talking to the person that's in front of us. There's no generalities, but yes, it can be a great and important part of the treatment plan.
Could exercise, the core exercises help for osteoporosis or other bone issues?
Well, for osteo, yes, absolutely. But it depends how we're doing those pelvic floor exercises, right? We know that in order to build bone density, we need to do some weight bearing exercises, but the pelvic floor and pelvic floor exercises don't live in a vacuum. Shouldn't be doing Kegels only when we're lying flat on our back or sitting and driving, right? We need to make them functional. So typically what I do is get as many, like, what are our goals? Do we want to build bone density? Do we want to strengthen the pelvic floor? Do we want to build cardiovascular endurance? And I try to prescribe an exercise plan that's going to encompass all of those. I'm all about multitasking, so we could get as many goals done with the most comprehensive exercises.
And the other thing is for osteoporosis, we also need to make sure that we can actually balance well. And
Absolutely.
those are core because we don't want to break a bone. We want to be able to be flexible.
Absolutely. And part of that is understanding the core and understanding how to use it to your advantage.
Right? So there's so much. So let's just talk a little bit about what it would be like to come to for a visit to a pelvic floor? Like, what would bring someone in? So I think that we've said enough that get someone
Yeah.
interested, but like, what's going to happen in our
Right.
first visit?
Great question. So, well, the first thing that's going to happen is there are some people who have a check engine light, meaning their body's telling them it's time to have something checked out. And some people really are just proactive. I have women in midlife that come to me every 6 months, like they go to the gynecologist to make sure that everything's okay. But you would come in, ideally, before you would come, the therapist would send you very comprehensive paperwork. You would come in. The first and most important thing that should happen is that the therapist should sit down and talk to you and educate you and listen to your story and listen to your goals. That's the first and very important thing that should happen. Because I will tell you that paperwork is important, but it's the stories that people tell me that I get the best information from.
So don't
Then
be shy. Say it all.
yes, yes, say it all. I always say this room is like a vault. What happens in this room stays in this room, and we need to be having open and honest conversations anyway. Uh, the next thing that should happen is a full body assessment. So nobody should ever go to a physical therapist and only get a pelvic assessment. That is, I am going to go so far as to say is that I am going to assume that never happens. But in our practice, people come and we start in standing. We do a movement assessment. We do a breath assessment. We do a core assessment. We do a strength assessment. I mean, a full body assessment to see, are there imbalances? How are you using your core? How's your alignment? How are you breathing? How are you transferring weight from one side of your body to the other? And then once that's done, we do a pelvic floor assessment. So that's either intravaginal or intrarectal. Obviously, for men, we do a rectal exam. Sometimes for women, we do also, depending on what their check engine light is. But 90% of the time for women, I would say it's vaginal, where we do a very gentle strength and endurance assessment of their pelvic floor. We look at each layer of the pelvic floor muscles. We look at each muscle in each layer. And then once that's done, the therapist should sit back down with you and go over all the findings. So in my mind, and help you develop a comprehensive plan. So in my mind, that's an ideal visit.
That sounds very comprehensive.
Yes, it should be.
And how long
There's
does that usually take?
So our initial assessments are 90 minutes, which is pretty long. I mean, I think it could be done in 60 minutes, but I know that the first time we're sitting down and meeting people, we don't want to be rushed. We want to have time to hear their story, and we want to have time for education, and we want to have time to do a very comprehensive assessment. So for us here, it's 90 minutes, and I don't think I would ever compromise on that.
Right. And so just if women in perimenopause, should they not be coming when they have their period?
They can. We treat women when they have their period. If they don't mind, we don't mind. Some women prefer
Because
not
you
to,
make
and
your
that's
appointment, and
okay.
then you never know when you're getting your period in
Yeah, we
perimenopause.
have women all the time that are like, I have my period. I know you don't care. I don't care. Um, yep, it would not affect your pelvic floor exam.
Mhm. All right. So how can people reach you?
Yeah, so we are really all over the place. We're in Boca Raton, but we it can help people virtually. Our website is pelvicorerehab.com, Pelvicore, pelvicorerehab.com. We're on Instagram at Pelvicore Rehab and Wellness. We are on Facebook, Pelvicore Rehab. We have a YouTube channel that's very robust called Pelvicore Plus. And I have a podcast called Your Pelvic Health. So we're really, really all over the place. If you do a little search, Susan Winograd or Pelvicore Rehab, we will pop right up.
You're all about education and helping people anywhere, really.
Yes, absolutely. I, do podcasts. I'm a guest all the time. As you know, I give live workshops all the time because the most important thing is to get the information out there.
And you're so passionate about it, and you're so
I
gracious
am.
about
I
it.
feel like everybody should be passionate about it.
Right. So thank you so much, Susan. This has been really
Thank
helpful. Just the
you.
tip of the iceberg on pelvic floor, but I think that it gives people enough to really tune into and probably make that visit to
Yes.
Pelvic Floor as part of your
And one,
overall health. Oh, just one other
absolutely.
question I wanted to ask actually earlier. At this visit, is it helpful to have your blood work?
Not at your, you can always bring it and we'll look at it, but it's not necessary. When we look at more global wellness, which is what we do, then it's more helpful. But that would be something that I would ascertain when we speak to someone on the phone, which is a good segue for we offer free 15-minute discovery calls. So if anybody listening has questions or they're curious, call up and set up an appointment for a 15-minute free discovery call. You have nothing to lose. So, I think curiosity is the first step, then taking action and learning a little bit more is the second. And that's why we do offer that.
All right. Thank you so much, Susan.
Thank you.
So
Thank you for
helpful.
having me.
Thank you for joining me in another fascinating conversation about midlife. If you'd like to reach me, Devora Krasniansky, to talk about your midlife or anything else, you can reach me at jewishmidlife@gmail.com. You can also find us on our website, jewishmidlife.com, and follow us on Jewish Midlife on Instagram or Facebook, and join our conversations in our Facebook group at facebook.com/groups/Jewish Women Talk About Midlife. And share what we're doing with your friends and others in the midlife phase.